Thank you. Thank you very much, and good afternoon, everyone. My name is Kimberly Beer. I'm the Director of Public Policy here at the Christopher and Dana Reeve Foundation, and I've been privileged to be part of the team since April of this year. And I'm here with my colleague, Justin Beland, who's Director of Health Practice at HCM Strategists, who will help us along this webinar. Again, I'm so grateful that everyone has joined us, and we'd like to share with you some legislative updates and some of the recent wins that the Reeve Foundation has achieved, especially with your help and involvement. And after the legislative update, we'll talk a little bit more about how we'd like for you to become and consider becoming more involved in the Reeve Foundation's advocacy efforts. And we have some opportunities for you to take part in some additional activities this August or coming in the fall. There won't be a lack of need for your continued support. So again, thank you for joining us, and we'll get started. The agenda today, as I mentioned, we'll go through a quick introduction. We'll go over some legislative updates from Washington, D.C. Around ACA repeal, the Paralysis Resource Center funding, the PRC, and a recent win around complex rehab technology and some additional legislation that will be introduced when Congress returns from their congressional recess in September. And then really the crux of the call, we'd really like for you to become more involved in the Reeve Foundation, and we'll talk a little bit more about the Regional Champions Program. And some of you on the call may already be a part of that, so we're really grateful for your participation. As many of you know, and I know that you've been a part of this extraordinary organization, the Reeve Foundation is dedicated to curing spinal cord injury by funding innovative research and improving the quality of life for people living with paralysis through quality of life grants, information, and of course advocacy. And this is why this call is so important and your involvement is so needed. I'm going to pass the call over to my colleague here, Justin, to give us a legislative update on some of the issues that I just raised earlier. Justin?
Hi, everybody, and to echo Kim's statement, thanks for being on the call. Greatly appreciate everybody being on. Before we start talking about some of the things Congress has done so far in the 115th, it's important to go over some of the things or to note how much they haven't done. This probably doesn't come as a particular shock to anyone, but it has been a very low year in terms of productivity, and I think that's going to illustrate, as we talk about some of our accomplishments, why they're a big deal. I'll confess this slide looks better in my head than it came out in reality, but the point is to show that every year there are lots and lots of bills that are introduced that do not become law. It's a political tool that legislators use. They'll go home to their constituents and say, I introduced a bill to do so-and-so, but they don't have any delusions that that bill is going to become law, but it helps to tell constituents they did something. So that's why you see a lot of bills introduced that ultimately don't go anywhere. All that said, statistically speaking, we are still way down in the number of bills being signed into law. Hopefully you can see on the far right there, it is less than 1% of the bills that have been introduced have been signed into law so far. And even those are mainly resolutions that name specific days of remembrance and things like that. There's very little concrete legislation. This is especially unusual because it's a non-election year. The non-election year is when most legislative activity takes place because members don't want to vote on controversial legislation in an election year, not to mention there's usually a few extra weeks where they're home campaigning, so there's just not as much time to get things done. So it's a little bit unusual to have this low of a number of bills being signed into law at this point. This is another way of looking at the same thing, basically. Remember, we still have the rest of this year plus next year in the 115th Congress, but again, unless there's a massive uptick of bills being signed into law, and there is no reason to think that there will be, this could go down as a highly unproductive Congress, if not the most unproductive Congress we have ever seen. But let's start talking about some things that have happened, and of course, one that I know everybody on this call was following, as was everyone in the country, and that was, of course, efforts to repeal or replace the Affordable Care Act. And you all know how that ended, as you can see here with Senator McCain voting no, much to Majority Leader McConnell's chagrin, as you can also see in that picture. Of course, there were also Senators Murkowski and Collins who voted no pretty consistently as those bills went through. And beyond that, of course, there were millions, and I literally mean millions of advocates across the country who wrote and called and attended rallies and came to Washington and stood in front of McConnell's door and did a whole bunch of disruption to make their voices heard and let people know this was extremely bad policy. Those voices, as you know, are still being heard across the country as legislators hold town hall meetings and they're back in their districts. All that said, if you've been reading in the papers that repeal and replace is dead, we're going to leave the Affordable Health Care Act alone. We've tried this. It's done. That's what you've been hearing, and of course, you probably know this, but Congress has a host of other issues they need to get to. They need to raise the debt ceiling by September 29th. They need to come to an agreement on how they'll fund the government past September 30th, lest there be a shutdown. And they have to do all that in the 18 legislative days that they have in the month of September when they return from recess. After that, they have tax reform, they have defense spending, they have a massive backlog of political nominations that have to be confirmed by the Senate. At this point, it is around 1,000. On top of that, there really isn't a big appetite to revisit any efforts to repeal and replace. They've tried it. They think it didn't work. All that said, there are other ideas out there being floated in terms of how this could look, and it would be silly to not talk about what those might look like, those plans. The biggest one that has been out there is the plan floated by Senators Lindsey Graham of South Carolina and Bill Cassidy of Louisiana. You may remember Senator Cassidy as the one who kept saying that any reform bill needs to pass the Kimmel test, which, remember Jimmy Kimmel went on his show after his son was born and immediately needed heart surgery. Cassidy said that he wouldn't support any bill that did not pass the Kimmel test. In other words, would have made someone like Jimmy Kimmel in that position not be able to afford the care their child needs. Then, of course, after making that promise, he went and voted for several bills which most definitely did not pass the Kimmel test. The details are on your screen, but in a small nutshell, the idea behind Graham Cassidy is to grant states the flexibility to opt out of the Affordable Care Act if they want. If a state thinks they're having success, they could keep it. Other states could pull out. Some could stay in. And in theory, every state would get what they want. That proposal, though, would eliminate subsidies for private insurance. It would end Medicaid expansion. The health insurance marketplaces would essentially no longer exist as they're envisioned to continue under other Republican proposals. The federal government would convert some, but not all of that savings and that spending into a lump sum payment, which is called a block grant. You've heard probably in the past of block granting Medicare, Medicaid, those sorts of things. So essentially this would block grant Medicare. States could choose to spend this money on providing insurance, or they could not. They could use it to fund high-risk pools. They could do other activities to pay the bills of patients who have high and unique medical needs. It's worth noting that states do not get this money for free. They would be required to kick in a small percentage, which would not make some of the governors happy. And on top of all that, this plan has not been scored by the Congressional Budget Office, which, once we see those numbers, will probably point to something not good. It's clear that this would cut deeply into federal funding for health law programs. It would likely result in millions of people losing coverage. And there is more detail we could go into on this, but the likelihood of it being brought up, much less even passed, is very, very small. It doesn't differ enough from previous plans to really get any kind of traction behind it. That said, more and more we're hearing talk about possible bipartisan proposals, which is a breath of fresh air for us D.C. folks. Mitch McConnell has said he would consider any bipartisan plan. Remember, Democrats have agreed that there need to be changes to the Affordable Care Act. So there is increasing bipartisan pushes to get this done. Looking at what those might look like, this is one offered, and it's indicative of what the other ones look like. There's as many as 6 plans out there right now being floated in a bipartisan fashion, some by the House, some by the Senate, some by former Obama staffers, some by former Obama and Bush staffers. This one is the one that's getting the most attention, and there is compromise on both sides. The conservatives in this bipartisan group who have strongly opposed the Affordable Care Act agree to shore up the main pillars of the law. They've backed funding cost-sharing reduction payments to insurers that the president has said he may end, which Republicans have opposed. This would establish reinsurance mechanisms to protect insurers that sign up to sign sicker enrollees, in other words, those high-risk pools. This would strengthen enrollment education and outreach. It would create better incentives, or at least good incentives, for people to maintain continuous coverage. So that all is there to all are things that Republicans have opposed but are now promoting in this proposal. Progressives who want to keep the law's consumer protections and want to give states more flexibility to develop their own systems for providing coverage to low and moderate income people. They got a lot of this in there as well. That would involve letting states combine federal payments for Medicaid, private exchange plans, and of course CHIP, the Children's Health Insurance Program, could be used to create seamless coverage arrangements. CHIP needs to be reauthorized at some point, which adds to that long backlog of things that need to get done by Congress prior to them adjourning later this year. So will this one see action? That is unclear. Congress, again, has a very packed agenda. But the fact that these bipartisan proposals are being discussed in a serious way is a breath of fresh air and could mean progress for just about anyone. I should have said this at the beginning, we will have time for questions at the end. We'll open up the phone lines, but if anyone has questions about any of this as we talk, by all means type them in that little box in the corner where it says participant feedback. We would love to answer your questions as we go through this information. So by all means, type in your questions or hold them till the end. Moving on to something that is much more, well, it's not much more important, but it is much more relevant to Reeve for sure, is funding for the Paralysis Resource Center. So for those who don't know, but I imagine that most folks on this call are familiar with the PRC, the PRC is a massive program that's administered by the Reeve Foundation with funding from the federal government, and we'll talk about that, to improve the quality of life for people with mobility impairment issues. It provides quality of life grants to nonprofit programs and projects geared toward improving the quality of life for people with paralysis. There's a robust peer and family support program, a national lending library of paralysis-related media, the Neuro Recovery Network, which is a cooperative network of rehabilitation centers, and of course our Military and Veterans Program, which is designed to support the unique needs of current service members and veterans, regardless of when they served, regardless of how their injury was obtained, and a comprehensive multicultural outreach program so that we can reach as many audiences as possible. There is no other program run by any other entity or the federal government that does the work that the PRC does. It is hugely important to the audiences that it serves. It is the first resource that a lot of people go to if they are injured, if someone in their family is injured. It is vital that this program continues, which is why we got a little bit scared by what I'm going to talk about. So I mentioned that the PRC receives funding from the federal government to carry out some of their activities. In the current fiscal year, that funding was $6.7 million. And a little bit about how the budget process works. In a normal year, what happens is the House will vote on a funding bill, 12 funding bills actually, 12 appropriations bills. The Senate will vote on their own versions of those 12 appropriations bills. And then they'll conference to work out differences in funding levels in those bills. Those 12 bills fund literally every single government program that exists, from funding members of Congress's pay to things like the Smithsonian, to things like any healthcare program that you can possibly think of, to anything. Anything that's funded by the federal government has to go through the appropriations process, which is 12 bills in the House, 12 bills in the Senate. Under regular order, like I said, each passes their own, they conference, and we get a number. It hasn't worked that way in a number of years, simply because there just frankly isn't the time. There's other legislative priorities, and Congress has more often than not rolled a bunch of bills into one giant bill, which is called an omnibus, or just kick the can down the road with something called a continuing resolution. In other words, they can't finish those funding bills if they don't have some sort of funding mechanism. There's a government shutdown, so they pass what's called a continuing resolution. This all starts with a proposal by the President and the Office of Management and Budget. The President outlines his priorities. Here's what I want. Here's the kind of funding cuts that I want. Here's the kind of funding increases that I want. It is rare that proposal, that budget proposal is, in fact it's never happened, that proposal is passed note for note by Congress because they have different priorities than the President. This year particularly, was worse. And these kind of are overlaid, and I apologize for that. But the President's budget, which you can sort of see in the background on the bottom line there, our budget was cut completely in President Trump's budget. Massive cuts to a lot of disability programs. And their logic, as you can see, this is the quote directly from the Trump budget on the screen. They basically said that the efforts of the Paralysis Resource Center were duplicative and that these programs could be rolled over into other areas of the federal government. As I've mentioned, there is no other program that does what the PRC does. There's nothing that comes close. And the idea of recreating these programs within another area, in this case, which they wanted to move it to the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. Even if a program like that could be knocked down and recreated within NIDLR, they cut NIDLR's funding by $9 million. So they were asking NIDLR to carry on all of the work of the PRC and do it with less money, all of which is a logistical impossibility and would leave many, many people, especially people who were recently injured, with nowhere to go. This could not stand. So we launched a massive effort, even before I get there, and again, I think this slide is probably not going to work because there was some overlay here. This basically expressed Congress's view on the Trump budget, and I think that the tweet you can actually read completely says it all. No one took that budget very seriously. The one behind this tweet is John McCain saying that the budget proposal was dead on arrival. So no one in Congress took this proposal very seriously, but we knew we had a lot of work to do to make sure that Congress understood the importance of the Paralysis Resource Center. So along with Reeve's staff, we held dozens of meetings with legislators on Capitol Hill, on the appropriations committees, on the relevant committees, educating them on the importance of the PRC. We had many legislators send letters to the chairs of those appropriations committees, highlighting the program, the importance of the program, some of the work that it's done for their constituents. We had legislators ready to make speeches on the floor of the House of Representatives, and we'll talk about that a little bit more in a minute. And of course, we unleashed our grassroots. Folks like you made emails, you made calls, you made your voice heard. In the midst of all of this incredible noise around repeal and replace of the Affordable Care Act, our advocates still let Congress know about the importance of the Paralysis Resource Center and how unbelievably detrimental it would be to remove funding for that program. All of which is to say, the House has passed their bill through committee. It has not passed the full House of Representatives, but they have reinstated that money, $6.7 million, identical to what our funding was last year. We still have to wait to see what the Senate does, but we have a number of strong champions in the Senate, and we are not too worried about getting their support. All of that said, with what will happen with federal funding this year is a little unclear. Again, Congress has a very packed schedule. They probably won't have time to finish their funding bills individually. Again, there are 12 of them. So they'll pass a continuing resolution which will fund the government at current levels, probably through the end of the calendar year. That's good news for us because we can almost guarantee there will be no cuts to our funding till at least December. And it allows us more time to work even harder to ensure that all of our funding ends up in the final spending package that they come together. This is a big win for us, though, to have been, it wasn't, we knew that Congress wasn't going to be taking that Trump budget proposal very seriously, but to have such overwhelming support in the House of Representatives for this program, which we are sure will be echoed in the Senate, is a big win. I mentioned we had a couple of members of Congress who were prepared to make speeches for us. At the time that they went on the floor to make these speeches, we actually had already gotten the funding through the House bill. So it turned into just kind of a celebration of the stories of people that the Paralysis Resource Center has helped. One of them was Representative Ted Deutsch, and I'll let you read this. Well, actually, I'll go ahead and read this quote. The value of these programs can only be appreciated when you learn the stories of the thousands of Americans that the PRC has helped with their services. Tonight, I would like to tell some of those stories. It is through these stories that we can see the amazing work of the Paralysis Resource Center, the lasting legacy of Christopher and Dana Reeve, and the bright future of so many who have been served through the PRC's programs. And he went on to detail some great stories of our advocates and people that the PRC has helped. Representative Deutsch was joined on the floor by Representative Jen Langevin of Rhode Island. Representative Langevin is the only member of the House that is in a wheelchair. And of course, there is a Senator, Tammy Duckworth from Illinois, who is in a wheelchair, but Representative Langevin is the only member of the House. And he said, Christopher and Dana Reeve were friends of mine. I miss them dearly. They truly did provide hope to me and millions of others whether affected by paralysis or some other nerve disorder or disabilities in general, or the families that are affected by this condition as well. They made a difference, as has the PRC. I'm grateful for their work, and I'm grateful for all the efforts to keep the PRC going strong so that they can continue to help those living with paralysis, their families, and for those who may be affected in the future. So again, just massive support from Republicans and Democrats in the House to get that over the finish line. And again, couldn't have done it without the advocates on this call. It was a big win, and we will keep everybody updated, of course, as funding moves forward. The last thing I want to talk about is a little bit more complicated, and that revolves around complex rehab technology. I'm sure most of you know this, but complex rehab technology, or CRT, are products or associated services including medically necessary, individually configured devices that require evaluation, configuration, fitting. These products and services are designed to meet specific and unique medical, physical, and functional needs of an individual with a spinal cord injury, among many other injuries. More specifically, CRT refers to individually configured manual wheelchair systems, power wheelchair systems, adaptive seating systems, alternative positioning systems. It is incredibly important, as you can imagine, to the 5.4 million people living with paralysis in the United States. It's designed to meet the unique medical and functional needs of each individual. And as many of you know, if you don't have the right equipment, it is hard to even perform daily tasks, much less go to work. And of course, it takes a psychological toll as well as a physical toll, having to work with equipment that is not the right equipment. So the issue that we faced around this was Medicare reimbursement for this technology. There were drastic reimbursement cuts that were scheduled to go into effect on July 1st if something wasn't done, which would have created massive barriers to anyone on Medicare trying to get access to CRT. Luckily, because of high-level meetings with CMS, the Center for Medicare and Medicaid Services, because of an outpouring of emails again and phone calls to members of Congress and to other people from folks, from advocates, from folks like you, we were able to reverse this cut to CRT. And this is a big deal for the mobility impaired community. It ensures continued and uninterrupted access to this vital technology. That's the good news. Here is the bad news. All of that applied only to power wheelchairs. There is no change, was no change, for components used with CRT manual wheelchairs. We will continue to work with Congress. We will continue to work and we'll continue to call on you to protect manual components. There is, as you'll see on your screen, legislation being introduced in September to fix this problem, so you will hear from us with a call to action. And in addition, while we're on this subject, and I apologize, this is even more in the weeds, we also need your help to create a separate benefit category for CRT. Right now, CRT is categorized by CMS under the same category as basic wheelchairs, as hospital beds, as things that are really not remotely related to the specific needs of people who use CRT. With advances in technology, obviously that seems a little silly and outdated. So we're going to be asking you to help us pass legislation to create a new separate benefit category so that we can avoid these kinds of issues in the future. All of this is to say we need Congress to listen to us. We need them to hear the voices of the mobility impaired community because without this group, without the folks on this phone, without our champions making noise, there won't be anybody up there to talk about this stuff. All of that to come back to us needing your help. And I'm going to turn it back over to Kim so she can talk a little bit about some of the things you can get involved with the foundation.
Justin, thank you so much. That was a lot, and we are so grateful for HCM's support and expertise, especially Justin's help. He's been working very closely with the foundation for nearly 2 years, so thank you. And I don't want everybody on the phone to panic if that was a lot of information that maybe you didn't quite all get. We'll be sure to send the recording around. And we also have information on our website around some of the issues that we just highlighted. So, and we'll also make sure that you have our contact information. So thank you very much. So how can you become involved? I know many of you on the phone already are probably advocates. And what I mean by an advocate, I mean an email advocate. So if you have not signed up to receive our action alerts, please visit our website and become an advocate. You see the button there that says Become an Advocate, and please fill in your information so that we can keep track of our advocates around the country, especially in key districts. And in future calls, we'd like to get into more of the weeds on how we determine where key districts are, but we really need all the support we can get, and all the folks on this call, we hope, will sign up if they haven't already. And you'll see under the quick links a lot of the things that Justin referenced around the PRC elimination and contacting senators around the Affordable Care Act repeal, and how you can learn more about CRT. We'll be continuing to update those quick links with additional issues as we learn more about what's happening in the community. And the way that we're going to do that is to make sure that we reach out to all of you to hear where you would like us to focus some of our efforts. Some of the work that the Reeve Foundation does is in coalitions with other organizations, but of course some of the issues are very specific to the Reeve Foundation's needs and to that of the spinal cord injured. So we definitely want to hear from you. So after the call, we'll send the information from the webinar, but we'll also send a brief survey to gather some information around where some additional issues you might want us to take a look at in the future. And as I mentioned, once you sign up to become an advocate, you'll receive alerts, and you'll get them in your email, and you'll see them on our website to take action, and the letters go directly to the members of Congress. And you can personalize the letters according to your personal situation or your experience, in this instance with the PRC. Another way that you can get involved, and this might be a little more complicated, but we're happy to work with each of you. If you don't already know who your member of Congress is and your senators, we'll be happy to work with you to make sure you know who to contact in the individual representative's office or the senator's office. And we can, right now, the Senate and the House of Representatives are in congressional recess, and they are looking to meet with constituents on issues of importance to the community. So if you'd like to learn more about how you might go about doing this, please, at the end of the webinar, our contact information will be listed, and please reach out to Justin or myself about how you can learn more about that. And you'll see that Eric LeGrand, who's an extraordinary ambassador for the Reeve Foundation, came down earlier, maybe about 6 weeks ago, and met with Representative Tom Cole, who's in the picture on the right-hand side, who's the chairman of the subcommittee on appropriations that oversees our funding for the PRC. And Eric had an extraordinary meeting with his mother, Karen, and talking about the importance of the PRC, and we hope that we can get more advocates involved in meetings like that. I want to distinguish, we use terms here in Washington between grassroots and grass tops advocacy. And what I talked about becoming an advocate, about signing up for action alerts, that is wonderful, and we need as many individuals involved in that as possible. And we refer to that here in Washington as our grassroots. The folks on the ground who are willing to send an email and maybe pick up the phone as soon as we need help. But then we also need sort of higher level folks who'd like to take on additional responsibilities around some maybe higher level issues, or issues of where we need individuals to reach out to a member individually. We may have to coordinate some additional efforts around that. And we'd like to refer to those individuals as grass tops. And so we're offering another additional opportunity for individuals to get involved at the grass tops level. And that program that Justin is really spearheading is called the Regional Champions. And I know several individuals here on the call are a part of that program, but I'd like Justin to talk a little bit more about that. And if you're interested in participating, of course, Justin will be happy to contact you directly and talk to you more about that if you'd like to sign up to become a part of that.
Absolutely, and I will say on the actually on the very next slide will be the contact information for Kim and I for if you need help setting up those in-district visits in August or anytime really. Or you want to get more involved with the Regional Champions program that I'm about to talk about, definitely send us an email. Our email addresses will be on the next slide after this one. But as Kim talked about, there's a difference between grassroots advocacy and grass tops advocacy. The grassroots is people who send the emails, they make the phone calls. That's very, very important. I don't want anyone to think, is my email going to make a difference? Is my phone call going to make a difference? Is my tweeting at my member of Congress going to make a difference? Yes, it is. They have staff that are charged with reading those emails, with responding to those emails. It is a very big deal. If you think, oh, well, all I can do, all I have time to do is send an email, that's still great. We need those emails. We need that communication with Congress. Again, we have to be the voice of the mobility impaired community, of the spinal cord injury impaired community, and it's got to come from us because it's not going to come from any other group. But if you are available and you have the desire to do more, we're putting together this Regional Champions program to kind of become those grass tops, that next level group of advocates that are going to do more than just make a phone call or send an email. We want them to, we're going to work with them to develop relationships with their member of Congress, so it's more than just an email. It's helping to set up those meetings in district and develop a relationship so that they'll know who you are when they see you coming, and they'll be amenable to seeing you with you and chatting with you. We can steer you towards in-district legislative events, town halls. I know many members of Congress have kind of shunned town halls lately, but they're still doing coffees and other events, and we can make you aware of where those events are and when they take place. We can do social media trainings to talk about how you can connect better with your legislators through social media, both Twitter, Facebook. We could do an entire presentation, and we probably will do an entire presentation on some point about using social media to advocate. But it's sort of the new way to do things in D.C. I mean, there was, the emails are great, but if you send an email to a member of Congress, it's going to go to probably a legislative correspondent, and it's going to be passed on to the appropriate staffer, and they're going to see it, they're going to log it, they're going to take your comments for sure. They're not going to ignore it. If you send a tweet at a member of Congress, the odds are good the legislative correspondent's going to see that. The chief of staff is probably going to see that. The communications team is going to see that. And many members of Congress use their own Twitter. They follow their own handle, and they know who's tweeting at them. So it's a good way to get to a whole lot of congressional staff. So we'll do social media trainings with our regional champions. Act as sort of de facto Reeve staff. Reeve is the foundation, as folks I think know, is based in Short Hills, New Jersey. We are not all the way across the country, and we would love to be able to have advocates represent the foundation across the country and be that link to Reeve. Recruiting others. Folks, if you've got your own grassroots network, people that you work with on issues, we would love to have them involved as well. And of course, sharing your story is a huge part of it as well. Nothing works better on Capitol Hill than stories. Stories of constituents and how their decisions, how legislators' decisions are going to impact their constituents. Those stories are very, very important. And we can work with you to develop your story and get that to the member of Congress. So again, this is a next level way of getting involved, and it will be hugely helpful to us over the coming weeks and months as we battle, as you've heard, as an increasingly hostile legislative environment. And we're going to need to cut through the clutter. You saw a lot of work by the disability community during the Affordable Care Act repeal debate. That can't go away. Maybe the next thing won't impact as wide a group as ACA repeal would, but if it's going to impact our group, we need to make our voices heard on it. So we would love folks to get more involved with us. And again, I will actually move the slide forward so you can see our contact information. Please do reach out if this is something you think you'd be interested in. We are getting this program up and running now. As Kim mentioned, there are a few folks on this call who are committed to being regional champions. We would love to add more to that list and hope that folks want to get involved. And with that, I will open it up. I will ask Stephanie, I should say, to open it up for questions.
Absolutely. If you would like to ask a question, please signal by pressing *1 on your telephone keypad. If you are using a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. A voice prompt on the phone line will indicate when your line is open, and please state your name before posing your question. Again, press *1 to ask a question. We'll pause for just a moment to allow everyone an opportunity to signal for questions. And there are no telephone questions.
I guess we were just that good.
We can definitely send the presentation slides along with some of the other things that we referenced during the webinar after the webinar is over. We'll just send a follow-up email.
Yeah.
And I believe we can also send the recording of the entire webinar as well.
And again, if you have specific questions about the Regional Champions Program, you're welcome to ask them right now, or you can also send us an email, and we're happy to answer those.
Well, we really appreciate your attention. Oh, how many regional advocates do you currently have?
At the moment, we only have about 6. So we've reached out to, I think, about 20 or so folks total so far. So we kind of went to a select group of folks who were doing some next-level advocacy for us, which is great. But now we want to open it up. I mean, if you're on this call, clearly you have an interest in advocacy, and so we wanted to make sure that the invitation was open to everyone here as well. The goal is the goal ultimately, and we're talking way down the road, is to have at least one in every congressional district, and that would be 435. We're happy to start with 25, 30, however many we can get our hands on this early. It's got to start somewhere. So this is the beginning.
Well, and I think that it's important to acknowledge, too, that when we were making the distinction between grassroots and grass tops, we were seeing the success we were having with the grass roots. And so, Justin developed this program so we can grow, which is why it's relatively small at the moment, too. And I see we have some additional questions around social media.
Yeah, so Twitter for outreach, and that's a great question. That could almost be an entirely separate webinar, since we do a lot of that, both at the Reeve Foundation and the consulting firm I work for, HCM Strategists. There are numerous different tools, and it might be easier to send me an email, and we can connect on more of this if you have specific questions. The way we've used it in the past is, let's say there's a member of Congress that we know we need to get to, that we just don't have a recognizable advocate. There's no one in our database. It's hard to find. We can use certain social media tools. There's one specifically called Follower Wonk to browse people's bios of their Twitter handles, and 9 times out of 10 in their Twitter bio, or at least in recent tweets, they've mentioned something about a disability or being a caregiver to someone with a disability, and we can reach out to them via social media and say, hey, this or that is going on in Congress that can affect you. And that's how we kind of gather advocates in places where we need them. But there's a whole bunch of ways that you can use social media for advocacy. So might be a good idea for the next webinar that we do down the road. But email me that question, and we can set up a phone call and do some things that way. It's just there's a lot. It's a big question.
Well, we can also do, as Justin said, an additional training on that if we get enough interest in social media. It's an important.
Absolutely. And the question about living in Washington State, agreed that your folks are lean a little bit to the left. However, they're also extraordinarily powerful. Patty Murray, as you probably know, is a ranking member of the Appropriations Committee, and so has the ability to basically put the entire party in line in terms of what we need on the Senate side. So not in the majority for sure, but by the same token, given her committee assignments, a very, very powerful person. And there are a few, of course, Republicans in Washington State. I can't think of any that sit on any relevant committees.
Kathy
but again,
McMorris-Rodgers.
That's true. Yeah, that's right. So not all leaning to the left for sure.
And I think it's important to also distinguish that, or to acknowledge that that's not really relevant. This is not a bipartisan issue, and every member of Congress needs to know who lives in their district, who votes for them, that they are in contact with someone living with paralysis. So while that was an excellent question, and thanks, Justin, for the answer, it's important that we need everyone's help, regardless of party or persuasion.
Someone asked if we're collaborating with the United Spinal. Yes. When we talked about that win on CRT, it was we worked very closely with United Spinal, and they did amazing work making some of those meetings at CMS happen, and working. It was a very, very big effort by both organizations. And yes, of course, anyone involved with United Spinal can become a regional champion as well. We're all in this together, so absolutely. Someone said they live in a state where their senator and congressman are strong disability advocates. Yes, your calls do matter because we still need to keep them in the loop, and we need to let them know that these are important issues, that maybe they'll likely vote the way we want them to vote, but by the same token, we need to make sure that they hear from us, that those things don't drop off. I do a lot of grassroots advocacy for a living, and during the healthcare debates, there were people saying, well, we've got to call Chuck Schumer to tell him not to do so-and-so. Chuck Schumer gets it. You don't have to call Chuck Schumer to tell him that he should vote against anything that's going to cut Medicaid, things like that. His phone lines are better used for people who are trying to get visas and his constituents that are trying to get services of that kind. That said, it never hurts to just check in with your member of Congress and say, thanks, here's the latest. Here's what we're up against. A lot of supportive members of Congress, Democrats and Republicans, did not know that the Trump budget cut PRC funding. They had no idea. I mean, the federal budget is so massive that they just didn't see these programs. So, yes, they're on your side, but they can't know what to advocate for if you don't tell them. So it's important to get involved with them no matter what.
And we have some support from Ohio. We'll reach out to you, Adrian. Thank you for your interest. We see that the chairperson also posted some ways to get involved directly, but please send us an email and we'll also follow up. I don't know if there's any additional questions. Really appreciate your interest and your time, but I'm sure everyone would like to get time back. No one would argue with that. Okay, well, I think that if there are no additional questions, we can adjourn for the day. And again, I want to thank everybody for joining us, and thank you for your support, and we look forward to working with you. Justin, anything else?
No, thanks, everybody. Really appreciate it. And again, any questions, reach out to us.
And this concludes today's call. We appreciate your participation. You may now disconnect.